Welcome to the Beverly Hills Plastic Surgery Podcast. Dr. J. Calvert, today with Dr. Millicent Ravello, sitting in a well-lit office at an earlier age because daylight savings has taken place not only here but also in Europe.
Hi, thanks for having me.
It's good to have you.
Thanks.
I'm happy that it's light outside.
I love it. It used to get dark so early, and now there's actually some daylight when we leave, which is really nice. I get to go home and water my plants. I don't like watering my plants when it's dark outside because I'm afraid of creepy crawlers. But now I can water my plants.
Before we get into nose fillers, which we're going to talk about, I promise, since we just did some nose fillers on one of our amazing staff members, I have to tell you that daylight savings played into the fact that I almost burned up in the hotel in Bergamo, Italy.
Oh, really?
Yes.
How so?
Because the time was off. And, so I said, well, let's sleep an extra hour. And during that time, because I was there with my son, we were in Italy for this rhinoplasty conference, the hotel caught on fire.
That's so crazy.
and Ace and I were in the hotel room while the place was on fire, and we were woken up by a very large, giant, really 6'6" or something, Italian fireman trying to beat down our door. And so I opened the door, of course, and he was like, fire. I was like, I see the smoke billowing down the hallway. So I said, Ace, we need to go. The place is on fire. So we got our stuff and got out of there pretty quickly. And the hotel did not burn down, which was good. And my only regret is that I grabbed a Anaheim Ducks shirt and a Pittsburgh Penguins hat. And so I was clearly going to appear on the wrong jersey cam if I were in the stadium.
Yes, that's the big regret.
Yeah, so that was the big problem. But we did not come home as charred crisps and body bags, which was good.
Most importantly.
Yeah, because it was bad. I mean, that place was definitely
Why
going down.
did it catch on fire?
Somebody threw a cigarette in the trash can.
Of course. Oh, Italy.
That was it. It's on camera. You see him. He's like this. He just goes boom, right in the trash can. It's like,
in the hotel?
Really? Yeah.
Oh, jeez.
So it set the place on fire.
Don't do that.
Anyway, back to what we were talking about.
Back to noses. Back to
nose fillers.
Yes.
So the reason we want to talk about this is because a lot of people say, oh, do you do non-surgical rhinoplasty? And I was like, yeah, I do. It's not like, I'm kind of a surgeon, though.
I know. Like, don't come to me for that.
I'll do it.
No. But I won't like it.
Do I have to like it while I'm doing it? Do I?
I mean, I get it, right? Like, if there's something about your nose you don't like, and maybe it's not a big deal, and you just really don't want to deal with surgery, you can't afford it, or it's just, you can't take time off or whatever. Like, it would be great if there was an option to fix the problems that you see without having to have surgery. I mean, it's a logical question.
Right. And I do nose fillers. In fact, what I do is, I try to create the look that could be created with surgery using the fillers so that, now everybody has to understand this. If you get nose fillers, your nose will be bigger.
Oh, yeah.
Well, there are some Instagram accounts, which will remain nameless, where they do nose fillers, and lo and behold, the nose is smaller afterwards. Isn't that incredible?
I'm fishy with that.
It's
I don't know how that's possible.
Fishy. It's not. If you add fillers, your nose will be bigger, period.
Wait, so if I put breast implants in a patient, the breasts don't get smaller?
No, they don't. They get bigger. That's the way it works.
Okay.
But I use nose fillers a fair amount. Fillers in the nose, I guess. They're not really nose fillers. They're fillers that you put into the nose. Because they have saved the day for little tiny post-rhinoplasty defects.
For sure.
All the time.
Right. Something you don't want to go back to the OR. Just a little bump or a little bit of asymmetry or a little scar ball. Just camouflage that with a little dollop of filler.
It's so nice. And it works great. However, there are risks.
Oh, yes. That is the big deal. And you will definitely find a decent amount of practitioners who just don't do nose fillers, and